The content herein is for informational purposes only, not intended as medical advice, diagnosis or treatment, and is not to be substituted for direct advice from your doctor.
Well, greetings and welcome to our LymphCast show, episode 56 tonight. We are very glad that you are with us. Just a reminder to visit our website early and often. That's lymphcastnetwork.com. Everything is there about the show, and as well as all the subjects that we talk about. If you have a question for any of the doctors on the panel, please email us at hello@lymphcastnetwork.com. Also, a reminder that every single episode, all 56, are on YouTube and every single podcast platform under the sun. Wherever you go, you'll find us, the LymphCast show. So we're glad you're with us. Let's go around the room and meet the panel. From Arizona, Dr. Monica Glavitsky. Hello, Dr. Glavitsky. How are you tonight?
Hello, everybody. Hello, my team and our distinguished guest, Laura. I'm excited to be with you after my traveling. I missed several episodes, and I'm so happy to be here with you today.
Yes, very good to have you back. And the gentleman who started this show, he's also the founder and owner of Vita Support MD. They make vein formula 1000, lymphatic formula 1000. Physician, surgeon from New Jersey, Dr. John A. Chubak. Hello, Dr. Chubak. How are you, sir?
Hi, Paul. I'm doing fine. Thank you. Good to see you again.
You too. It's been about a month since we've gotten together. Glad we're together. Let's kick it right off. I'll turn it back to you, Dr. Chubak, if that's okay. I'll have you bring our special guest in, and then off we go.
Sure. Well, it's my privilege to introduce Dr. Laura Swoboda. Dr. Swoboda has her doctorate as a nurse practitioner, and she has a long and storied education and career. I'll touch on a few of the points. We don't have the time to go through all of them. It would be the whole show. But she started out at the University of San Francisco studying biology, French, and education, and later went on to get her Bachelor's of Science in Nursing from the University of Phoenix in Arizona, and took her doctorate in nursing practice and family nurse practitioner in 2018 from the University of Wisconsin in Milwaukee. And she has been very, very much devoted to a career in wound care, and currently is director of skin and wound care at the Healing Institute. And she's an adjunct professor of health sciences at Waukesha County Technical College. So before we go any further, I would just like to say that her CV is replete with lots of great scientific work and research and publications and so on and so forth. So she has really committed herself to the field of medicine, as we could see through her extensive education, and the field of clinical medicine and research. So, Laura, welcome to the show. It's so good to see you and so good to have you.
No, wow. Thanks for having me. Next time I have an interview, I'll just have you, we've always got the same glasses. So I think if you just wore a wig, we'd be good.
I'd be happy to introduce you anytime.
All right.
I told you that he's very good.
Yeah, no kidding.
Well, we've had a few episodes to practice by now, right, Paul? So
right.
The first thing that I wanted to touch on is that Laura, not too long ago, returned from Gaza, where she went on a humanitarian medical mission to assist with sick and injured people there. And I think that this is an extraordinary thing to do, extraordinarily brave, extraordinarily humanitarian, and extraordinarily American thing to do, if I may say so. So, Laura, please, I know this is something that you'd like to discuss. Please share anything about your experience with you that you'd like. I'd love to hear about that.
Yeah, absolutely. So, I mean, I could spend the whole time just telling you stories from trading cigarettes for Red Bull and the whole way through the Sinai Desert, even before we got there. But yeah, I went to the Gaza Strip to Rafah with Fajr Scientific. It was an international group, but a U.S.-based NGO of doctors and nurses. And we were at the European Gaza Hospital in Rafah, and we were there while it got invaded, while Rafah was invaded. They took the border and we couldn't get out. And so we were there, at the hospital, extended past our stay as we were waiting to find out, if we could get out with the UN, who we had gotten in with, or, how we would eventually get out of there. I was treating wound patients primarily. So you can just imagine what war injuries look like in that situation where roughly 2 million people were inhabiting a city that used to be a couple 100,000, just, refugees pushed into an ever closing area. And, we were seeing, lots of pediatric injuries, and I do see some peds in Milwaukee, but usually only down to like 10 years old or so, and not these kind of super traumatic type of injuries and things like that we were seeing. So a lot of people in external fixation, a lot of people that were essentially awaiting amputation. My first day, I rounded with the vascular surgeon. He was a Palestinian doc who had been working at the EGH hospital the entire war. And he just, he put his head down. And he's like, oh, we're hopeless. And then he kind of like put his head back up and got back to work again. And we saw, 22 patients that morning just rounding on them. And pretty much all of them were needing further amputation. They were infected, full of maggots and things like that. So a lot of really, really severe injuries. A lot of wound needs there. So I would encourage anybody that's interested in going to, submit your CVs to volunteer with these NGOs and see if you can go and you can help.
Wow, that's pretty impressive. So how long you stayed there?
We're there 3 weeks. Mm-hmm. Yeah. And as we're trying to still be useful, but there's a lot of our practice, and it's not just as a wound specialist, but we had, a GI doc from Oman, actually, real funny guy, and emergency medicine people. And so all of us, as our supplies were dwindling, we didn't have access to the tools that we usually have to take care of people. For me, that looked like we didn't even have soap to cleanse our own hands, much less wounds. Looking at, whatever dressings that I could accumulate and bring with me, we didn't really have more than that. The GI doc would need not only scopes, but things to clean them with, and, all of those things that we take for granted on a day-to-day basis that weren't available there. Yeah. So we were very, very creative in how we would treat people. And it wasn't really, you weren't able to like create and implement a treatment plan because you just had whatever you had next to you for the day. And that's what you have. And you take a dressing off and you just put on whatever you have available. You know what I mean? So it's really, really difficult. And actually my translator that I had been coupled up with, they had to evacuate once Rafah was being invaded, and they needed to go out to Mawasi, which is at the beach. And so my translator left, and I speak like 4 words in Arabic. And so I'm like, all these people are so trusting of me because I don't even speak the language, and they just kind of come in with a wound and they're like, okay, like here's this huge wound, and then I just kind of take care of the wound. It's like you're doing the best you can with what you're given, and you just sort of do an assessment of the wound and do the best you can at that time.
Yeah. Well, I suppose that it's all practically the traumatic wounds. It's obvious, so maybe the language is not that much missing because, the circumstances.
Yeah, so we had a good amount of, like you say, just, straight up traumatic war injuries from shrapnel or from barotrauma from blasts of bombs when they suck in and then explode out. A lot of shrapnel and things like that. But we also saw people with injuries from like evacuating. So they'd be sitting on top of horse-drawn carts and stuff. So like head traumas and things like that. And then, but also, speaking of the LymphCast and, venous insufficiency and things, people with uncontrolled chronic diseases. So I saw people with, uncontrolled heart failure and big weeping legs and venous leg ulcers that just, they couldn't care for them. And so they were getting infected and, all of those kind of tertiary health issues that happen when you don't have access to sanitation or tools to take care of your chronic diseases.
Certainly, I imagine that it was traumatic to you too, to see all that misery. You all did what you could, but I suppose that it's terrible that you don't even have the access to the elementary things that you would need.
Yeah, absolutely. And just like I said, the number of pediatric patients that I saw, I got a lot of experience in a very short period of time. And we had no pain medication. We had ketamine and Tylenol and ibuprofen. We had no fentanyl, morphine, or anything. So people with traumatic amputations, with wound infections that were needing to be cleansed and treated, we weren't able to pre-medicate them. And so you can imagine someone with maybe a necrotic piece of muscle or something along their tendon and an open wound that needs to be cleaned out, how horrific that can be, not just for the patient, but for everybody in the room that has to kind of hold them or, try and get that done.
It's really unimaginable. I mean, I've had a lot of trauma surgery experience myself, having, gone to medical school and surgical training in Newark, New Jersey, and did trauma in Philadelphia and up at Yale, New Haven. And I had up in Rochester, a lot of trauma exposure. And trauma is a very difficult field under the best circumstances with all of the best facilities and medications and technical tools, dressings, and so forth at your disposal. It's an extremely challenging field, which is beyond the imagination of most people, quite frankly. So to be dealing with injuries, both acute and chronic, in a trauma setting, in a war-torn circumstance, seems to me almost unimaginable how anything can get done, and quite frankly, how anybody gets better or even survives. I mean, did you have access to antibiotics and clean dressings and things like that on a regular basis?
So I brought as many dressings as I could. I brought as much hypochlorous acid as I could and betadine and things. We had some antibiotics, but again, I would have been interested to have been able to run diagnostics on the antimicrobial resistance there, because I suspect everybody had been getting the same antibiotics for extended periods of time. And, the resistance rates are probably just astronomical and they're not even being effective. And just like you say, it's what are we even doing here? It felt like for a while, because we, put a dressing on people, they would evacuate to the beach and then what? There's nobody to change their dressing. There's nowhere to get more antibiotics, to get food or even water once they're there. And so there's really that feeling, of despair, where you're discharging people to die later, essentially. And I'm not sure how those deaths are being captured in terms of the statistics that are being reported.
So were the surgeons able to function? Is the operating room going 24/7? Is there general anesthesia available? I mean, you mentioned ketamine, but what are the circumstances for the OR?
We were running out of propofol, like literally last 2 vials of propofol. So we had a really, really great team of anesthesiologists, a couple from literally they were a husband and wife team from California, which was so sweet. And they would not sleep. They worked for days on end in the OR, running those ORs with the surgeons. We had a number of podiatrists, a vascular surgeon, an orthopedic surgeon that specialized in the brachial plexus, so a urologist. And so they would be in the ORs, especially the first week. They were working basically without stopping, just constant turning around until Rafah was invaded. And then a lot of the hospital staff, so the ER doctors, everybody, that was normally employed at the hospital, they had to evacuate because they were told to evacuate from the evacuation zone. And so the hospital, which was already very tenuously running even before the Rafah invasion, all of a sudden the staff was cut like more than in half. There was almost nobody. And there's all these people on the wards languishing, covered in flies. And there's nobody to do much less the amputations that I talked about earlier, where the vascular surgeon had everybody that needs an amputation or a revision. Or a wound debridement, because I do a lot of really vigorous wound debridements bedside, but I have good pain medications. I have topical, anesthesia. And so I'm able to do those things, but people had to go to the OR for them because they needed to be put out because that's the only thing we could do for their pain. So we did what we could, but then those surgeons, when the Rafah invasion happened, they had to go staff the emergency room, and they were just resuscitating the children and, the burn injuries, the trauma that would come into the emergency room. And so we only had one OR running for the entire hospital.
It's heartbreaking and mind-boggling to even think about.
Yeah.
How was your safety as a team of international healthcare personnel?
Yeah, so in the beginning, we were at a safe house along the border of the evacuation zone. And there was heavy, heavy bombing, so much so that it would wake us up at night. It would shake the walls. And we could see, always the artillery fire from the tanks and eventually gunfire. And it was really just escalating in terms of severity, the bombings. The drones were constant, where you just always hear this like, they're just always over there. And so in the beginning, we felt pretty safe because we had our little U.S. flag and we're like, we're just here to help. I don't know. But then after the invasion happened, our safe house we got the evacuation order. So we weren't allowed to be there anymore. So we ended up needing to sleep in the hospital. So we actually slept in sleeping bags on the floor in the administration office. And then every morning the administrators would come in, and be like, okay, like kind of kick us out, we need this room to work. And we slept on the floor, and we were running out of food. We had to source our food from the streets, just like all the other refugees. And we were running out of water. We're using chlorine tablets and reused water bottles and things like that. A lot of us had febrile diarrhea. So I had like cholera during this. I had a big hiking backpack full of wound supplies and active cholera that I was like tooting around. You feel me? So yeah, it was rough. It was rough, even for us. And we had it easier than the Palestinians, right? So
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Yeah, I was going to ask you about, there must be a massive problem with communicable infectious disease, dysentery, cholera, diarrhea, especially with a lack of clean water source and so forth. What is the circumstance there? You had a GI specialist with you.
He did. Yeah. We had a joke about him scoping the tunnels because he was the GI specialist there. Maybe a little off brand. But yeah, so I mean, you don't have diagnostics, so you don't know what is going on with people. But, you know, with us, we're trying to guess based on our best knowledge on the onset, the other symptoms that are going along with it. So it's febrile diarrhea, which puts it in a different kind of bucket. It could have been like giardia, but that tends to take a little bit longer to set in. It could have been, you know, hepatitis A. I remember the urologist, there's a British guy, walked in super pale, and he's just like, I think I have hepatitis A. It's just like, sit down, the, you know, anesthesia will give you an IV of saline, and yeah, because there's no way to tell. What are you going to do? Smuggle your stool sample out when you finally leave for like a lab to run? They're just not doing that. So, it could have been all of them.
You had things like, you had good access to angiocaths and IV tubing and sterile saline and things like this?
No. So, you know, one of the problems, and it's not just Gaza, it's like any resource poor setting, is that it's like the tubes don't match up, right? Like Apollo 13 mission where they needed to put a round thing in a square hole or something. That was just constant. It was like, here, we don't have the Christmas trees for our oxygen tubing. Now we can't give anybody oxygen. Like, we don't have the canisters for the wound vac machine. Now we can't use an electrically powered wound vac, those types of things. So it was all about also like finding whatever you do have, IV catheters of whatever size, and putting those in, even if you're not familiar with how to use them, certainly not safely, you know, in terms of preventing needle sticks and things like that, you know, just doing your best with whatever you find.
How was your access to electricity now that you mention it? It was running on generator power, or?
Yeah, so the hospital had some solar panels, but they were primarily running on, it's a huge hospital. It's like 650 beds during normal time. And then there were like 20,000 people living in and around it as refugees and within the hospital, like in tents. So there's tons of people in there, way more wounded patients than 650. So it's running off of diesel fuel. And it did actually run out at one point, and I had to go around. I was in this ward, and it went just completely black. And somebody turned on their cell phone flashlight and was like, you know, blah, 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 in Arabic. I don't know. And so I had to go and find the patients on wound vac machines, electrically powered wound vacs. We had a couple, and change them to this mechanically powered, but a big one. It's called a Pregmavac. So switch them over to that machine so that, you know, they could still get a wound vac, but they couldn't have power anymore. And so the WHO, I think, eventually like got them another 2.5 days or something like that of diesel fuel, but it was always just kind of like down to the wire of running out of electricity.
Mm-hmm.
It must have been absolutely terrifying when you were in those situations where you heard, you know, explosives actually detonating, or gunfire and drones. And honestly, you must have really been terrified.
The scariest part, you get pretty used to it pretty fast, because the drones, you're not scared. You know, like they call them the Xenon, which means like Beelzebub, like flies, Lord of the Flies. So it means fly, like buzzing. So you hear the drones, and that's okay, because then they're just watching and you're okay. But then the drone sound will go away, and there's this like pause, and then you're like, uh-oh. And then the fighter jet sounds start. It's like, you know, just like an airplane overhead, but you know it's a fighter jet because it's a war zone. And then there's a pause with that sound, and that's when they're dropping the bombs. And that's where you're really like grabbing people next to you, like, because you don't know, is it going to hit you? Is it going to be close by? Do you need to respond? You know? So that was the scariest timing, when it's real close overhead and you can hear that pause, and you're like, and you're waiting to see if it's going to fall.
Well, I give you tremendous credit. You're truly a hero, an American hero, a medical hero. It makes me proud to know you and think that you know, have such compassion for other human beings that you would put your own life on the line. I know you have a family of your own and so forth. And And it's just extraordinary to me that people like yourself do what you do and have done that all over the world for decades and more. But this is sort of an exceptional situation because unlike some circumstances where there may be MASH hospitals and things like that, sort of outside of the active area of combat, you and your team, I think you called it the Fajr team, is it? We're in an active military zone, and in an area where you could have been killed, quite frankly. So again, I thank you for your not that you're a military personnel, so not your service as a military personnel, but your service as a human being and a compassionate human being and an American and a colleague in healthcare. It's astounding to me. Really, thank you so much.
So nice of you. Yes, of course. Yeah, I think humans, right? That's what humanism is what I kind of commit myself to. So it doesn't really matter your religion, your skin tone, where you live, your socioeconomic status, what side of a border you live on. We all deserve to have good health care. And I just, do what I can. I think we all were seeing those videos and we felt really kind of helpless, like, how can I help these people? And so I volunteered and was selected, and I felt, really honored and privileged actually to be able to go. Because, it's an honor to take care of those people, and for what they were going through, those are the heroes. The people, the staff of the hospital are not being paid. Since the war started in October, they have not been paid, and they show up to work, and their homes have been destroyed. They have no food. Many of them have lost family members, and they just keep coming to work and keep just sludging and taking care of these people, each other, in horrific circumstances. They are just amazing.
So tell us what is how is the process of the applying and is that a specific American organization who is working with the humanitarian aid for Gaza and other countries maybe?
Yeah, so when we crossed, we went in from Egypt, and we got to know a number of other NGOs, non-governmental organizations that were coming through as well. So there's, besides Fajr, which means dawn in Arabic, it's the name for the first prayer that Muslims do. So Fajr Scientific was the group that I went with. So if you're interested in volunteering with them, you can look up FAJR. And then you'll be submitting a CV and I think some letters of recommendation. There's an interview. They're actually leaving to go to the West Bank in like 2 weeks or something for a big surgical mission, primarily surgical. But they'll be having recurrent medical missions, surgical missions, as they're building a field hospital there. So if you're interested in volunteering, you could Google that, put that in the Google machine. Or H1 is actually how I first got connected with this. So I do, a lot of medical consulting. And so one of the organizations was this H1. And when the war started, they kind of flipped their healthcare logistics into sourcing volunteers, both for Israel and for Palestinians. And so I actually volunteered for both. It was just that Israel was like, no, we're good. Like, we have enough supplies. We don't need you. And Fajr was like, yeah. So I ended up going with them. But if you look up H1, you can find a number of different NGOs that go. There's Med Global is one. PAMA was there with us, the Palestinian American Medical Association. So lots of different ways to volunteer. And even if you don't want to go, which is reasonable, it's not. I'm relatively well traveled. I've been to resource poor settings providing medical care before, and this was like a whole different can of beans. You know what I mean? So if you're not comfortable with volunteering, you can always donate or see if they would be interested in telehealth, that type of a thing.
No, it's to me, when you watch these things from afar and it looks so chaotic and devastated and dangerous and unpredictable. It's a mystery to me. Obviously, there's some system in place, but how you even get in and out of an area like that physically, logistically, from a practical standpoint. You did, am I correct in understanding that you did have a little bit of trouble exiting when you were all ready to go? Is that correct?
Yeah, absolutely. That was like a Bourne movie or something like that, getting out. It was like, finally the U.S. Embassy was like, okay, because enough of our family members had called complaining or something, like, fine, I'll get you out. And so, and then once the U.S. Embassy was like, fine, we'll get the Americans out, the British Embassy was like, yeah, okay, we'll get the British people out too. So we were able to leave, the Americans and the Brits, but everybody else had to stay still. So there were a lot of Jordanian people that came with PAMA, the Egyptian, the Omani from our group. So we left people behind, but we were able to evacuate. We had this really specific route through Rafah where we had to go up and around the fighting and down and then along the border. And it was so scary because about, a week before that, a UN person had been killed because what we had heard was that their driver had taken a wrong turn. They had the route approved, everybody knew where they were going, but the driver just went the wrong way and, they shot at them and somebody was killed and another person had a bunch of shrapnel in their neck and it was a mess. So we knew if you took a wrong turn, it was going to be bad news. So we're like, oh my God, every turn we're like, okay, check very carefully, and we had multiple checkpoints where we had to stop, get confirmation that we could proceed, and eventually, made it all the way along there. And as we got back to the first crossing, the human crossing that was captured, a big tank was in the way, in between two huge concrete panels, and just like tank pointed right at us. We're like, oh. So we were stopped in front of this tank.
I think it's good that Laura seems to have an excellent sense of humor. I don't think I would have been as giggly in all of these circumstances.
Well, I was the responsible one. I was the one telling these surgeons, like, you guys, be serious. Like, they can hear everything you're saying. Like, don't piss this teenager in a tank off right now. Like, be nice. And so they had to get clearance or who knows what, and after a long time of just like tank at us, they eventually moved it out of the way and then moved the tank and we could, go and get out of there.
John, I will say, I think Laura's the first guest we've ever had who said we had a tank pointed right at us and she laughed about it. That's the first time.
Exactly. Yeah. The gunfire and the detonating munitions and she giggles through the whole thing. It's fantastic. She's the perfect person for these kinds of missions. I can tell you that. She's obviously has an indomitable spirit and a lot of courage. And all I can say is God bless you. Thank you again for the work you did to help those people who were, obviously in need of care and suffering. Shall we cover
How was it to come back after this horror? Because it's like the horror story, despite your sense of humor and courage and everything, to come back to your normal patients.
Yeah, having a high resource setting. And having all of these supplies at your disposal, and seeing patients. And it's interesting because in the U.S., you get a taste of that every day, especially working in wound care, where people have poor insurance coverage or no insurance coverage, and you can't do what they need for people. People have food insecurity here. It's just that, obviously in Gaza, it's everybody and it's just all day long, but you get that exposure to these like really sad personal social determinants kind of stories here as well. But yeah, it was definitely an adjustment coming back and having soap in the wall. I actually got sick again when my like cholera or whatever flared up, and I was in the emergency room. I'm sorry, I'm smiling again, but like I was in the emergency room and they put me in isolation and they called the CDC because they were like, she was like all over the place and whatever. And I was just in there and I'm vomiting uncontrollably. And I'm just like, oh, it's so clean in here. Like these hospitals are so beautiful. It's so clean. And so that was, it was nice. And it's nice with a taste of bitterness because it's like, well, you want everybody to have access to that. And
credit for all these other countries and patients.
Yeah. Yeah. And I still have kids there that will, message me on WhatsApp, and those are, really hard. They're like, Dr. Swoboda, I love you. And, that's a little heart-shaped hand gesture for I was just listening. But then they're also like, this is hell here. Get me out of here. And this is like a 12-year-old texting. And they'll send photos of their house, all demolished and concrete. And you're like, oh my God, like, how do I respond to this? I don't even know what to say in this situation to this person. It's really, really hard.
It's unfortunate you cannot save them. It's like a little bit hopeless in our relationship because what can you do?
Yeah, exactly. And it's like every message you get, you're worried, that it's going to be that someone you knew finally was in the wrong place at the wrong time and didn't make it. So,
John, we lost your voice.
Oh, I'm sorry. I just, my goodness, that must be a terrible feeling to know that you were in contact with patients who later you found, were lost to their injuries or illness, et cetera. It's a very difficult thing. We as physicians, we've all been through that on a small, a smaller scale. In our clinical practice, occasionally there are patients who succumb to disease, et cetera, but I can't imagine in such a environment how the medical community is dealing with the ongoing level of grief, which must be continuous and overwhelming, especially when you point out that they're in a circumstance where people aren't really, they're not in a position to take any time off. Those who are committed to the process of taking care of other human beings as medical professionals who are there, they don't get any break away from it, any time to reflect, any time to mourn, any time to grieve. It just seems like a absolutely horrific circumstance.
Yeah, they're just trying to keep their head above water. I mean, they're just trying to stabilize people, keep them alive, but that there's no even thought yet about how, these revisions that are going to be needed, these complex orthopedic surgeries, people would come in and their arm would be just completely deformed, on a whole different level. They show you this x-ray on their phone and you're like, there's nothing I can do for you right now. And also there's one OR and that surgeon is, amputating this kid's arm, trying to keep this kid alive. He's not going to be able to do that for, 6 months maybe. So these people that do survive are going to need continued medical care for years and years and years, and obviously psychiatric care for the rest of their lives. I mean, this is just absolutely horrific for anybody to go through. And all the people living in the hospital, those kids, everybody's just standing there outside of the emergency room every day. And those kids are watching as these people come in completely burnt, completely almost unrecognizable in terms of being a human. Mm-hmm. Yeah. And they're standing there and they're seeing all that. And it's just, it's terrible.
Yeah.
Yeah, it's hard to imagine how healthcare is proceeding in Gaza throughout the whole strip, given the amount of destruction and devastation to the healthcare system. I don't know. For me as a physician, it's unimaginable how routine healthcare is proceeding in any kind of rational or reasonable way. I mean, it's beyond my comprehension.
Yeah, there's no routine healthcare. I mean, people don't have water. They're like digging in the sand to try and get down to the water table where they get this like brackish water, and that's just to drink, and then they're trying to source food every day. So there is no healthcare. If you get a GI illness, you're vomiting and, have diarrhea and everything like that. I mean, you die very quickly of those things because there's really not even anywhere to go to be fluid resuscitated to get antibiotics. Those places are already overwhelmed. While I was there, I did get a chance to go to a new field hospital that the Red Cross set up in Mawasi on the beach where, they had told everybody to go. But I mean, they had a couple of ORs. It was a very nice facility, but not anywhere. I mean, they would need so many of those to be able to care for all of the displaced people.
Yeah, I mean, I don't know. I'm not familiar with what the general level of care in Gaza would have been prior to this. But my understanding was that it was fairly sophisticated. I mean, people who need, let's say, dialysis treatment, chemotherapy, et cetera, who are undergoing chronic care for chronic illness. I mean, I would have to imagine that there's little or no access to those things.
Exactly. Yeah. When we were at Nasser Hospital, where it was completely destroyed, many of the physicians and the patients were executed during the invasion, and the dialysis center was completely burnt. So we saw the burnt out building of the dialysis center that before had been able to manage those chronic diseases and take care of people at that sophisticated level. And that's actually what Fajr did before the war, is they would come in with experts, international experts of surgeons primarily, and teach complex surgeries to the medical staff at various hospitals in the Gaza Strip. So they already were functioning at quite a high level. And then, obviously that's completely decimated with the war. When we were at Nasser, they had one dialysis machine that they had just gotten, and they were working on getting it started again. So there was this very, very brave man, didn't have much of a choice. It's like they're trying to get this dialysis machine going. It's making these ominous electrical beepy noises, but he has no choice, right? It's like dialysis or nothing. So he has to be the experiment and get that one machine going.
Wow.
Mm-hmm.
Paul, Monica, any other questions on this subject before we kind of turn to something a little more in our wheelhouse?
No. I think once again, I admire your courage and this humanitarian action, because that's certainly much needed. And even with that, it's just a drop in the ocean, right? Mm-hmm. So certainly, I think if the people can volunteer or donate, we should encourage everybody to do so, mm-hmm. for whatsoever side, because it's just a question of the humanitarian activity.
Yeah, and for the duration too, that this is going to be a long-term need. So even, years from now, that we're going to need to still have medical surgical teams going there to do revisions and orthopedic surgeries, rehab, PTOT, all of that. Mm-hmm.
And I'm praying for this war and this whole terrible situation to be finished as soon as possible. Because this is such a drama. This is a tragedy, human tragedy. Absolutely. Yeah.
Can I weigh in just a moment there, John? Laura, I want to ask you, you said you carried in as many dressings as you could possibly do. Mm-hmm. Is that fairly normal in war situations? Is there no outside organization that can fly the things in for you? Or do all medical personnel generally expect to bring their own?
No, that's not normal, even in conflict zones. So normally you still have routes where supplies and food can still get into people, so that, innocent civilians aren't, unnecessary casualties. And so there, when we went in through the Sinai Desert, we passed through a town just outside of Rafah along the border, where we saw semi-trucks packed with humanitarian aid and medical supplies, 5, 6, 7 semis, to each side deep. And for 4 minutes driving at highway speed, just semis waiting to get in, and they couldn't get in. So there was all this food rotting, the supplies, the medical supplies baking in the desert sun. Who knows? I'm pretty sure human albumin wouldn't still be something you'd be able to use after it's been sitting in a truck like that. So no, normally, even in conflict zones, there's still some humanitarian aid that's allowed in. And we were actually the last group that was able to get, I carried 12 duffel bags full of medical supplies, mostly wound supplies. And now they're only letting 2 people in a group, as opposed to ours was 40, not just Fajer, but Pama and everybody. And that those people can all only have 2 suitcases. So if you're going into a war zone, you want those 2 suitcases to be emergency supplies, solar powered, chargers, and all the things you need to survive, your chlorine tablets, your life straws, that type of stuff, scrubs, maybe laundry soap, what have you, food for yourself. And so once those 2 suitcases are full, you can't really bring in much more for other people. So it's basically at a standstill. It's I'm certain it's much, much worse than when I was there. And when I was there, we all just kept saying, this is like living in a simulation. I can't even believe this is real. I was just standing in there, surrounded by just people dying, covered in flies, and there's not enough people to even ask if they're okay. And thinking oh my God, someone's getting a pedicure right now, around the world. It's hard to even imagine something like that could ever happen. Yeah. Uh-huh.
Yeah, that's why I ask you, what shock had to be for you to come to the your normal life here, and to your wound center, which is certainly not the place of joy. I mean, it's your profession, and you are doing certainly this profession with a lot of commitment and so on. But it's coming from that to your wound care center. It was like coming to a normal life after the nightmare.
Yeah.
Laura seems to be coping with it quite well, but I could see, Monica, how many people under that circumstance could, experience some post-traumatic stress and things like that. I mean, it's quite shocking. Again, they're not military personnel, they're humanitarian healthcare workers and so forth, but nevertheless, the exposure to the sights, the sounds, the emotions, and those experiences can kind of have an impact later when you're removed from the circumstance, I would think.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
And I had never seen a dead child before. I guess I was very fortunate in that. And, as Americans, we're not very comfortable with death to begin with. So that, just seeing one dead child is enough, right? That's very traumatic, but that it's just everywhere, every day. There's kids walking around, no feet. They'd have no prosthetics. They're just walking on their stumps, sitting in wheelchairs with, quad amputees and things like that. So yeah, I'm sure, I'll be unpacking things for a while in my head, but yeah.
Last question for me, Laura. You mentioned, I think you were there about 3 weeks and they got the Americans out, they got the British out. Were you folks replaced, or they just had to go understaffed for a while? Because a lot of people don't know how this works. If I'm asking for a general consensus.
So typical NGOs, non-governmental organizations like the Red Cross or Doctors Without Borders, so they'll go in small groups, like 2 people, and replace them because they stay for a long time. They stay for like a minimum of 3 months, usually like a year. And so they go in and they get clearances, and it's not, as big of a thing. But for us, we weren't being replaced because they were only going to let, again, 2 of us in. But we were a group of, a larger group. Fasher, just us, was 16. So we were 16 docs that needed to get in. So no, we're not being replaced. There were 2 people that were able to get in after us, after, couple weeks. They did get the agreement between the UN and the Israelis and the Egyptians and the Palestinians and everybody, whatever, finally agreed to let at least 2 people in. So they're still just incredibly understaffed. If they brought in a fleet of people, they would be understaffed. That's why Fasher is working on building this field hospital, because so many of the hospitals have been destroyed. And so if you can bring this kind of modular hospital in, and it's got ORs and units and an ED and, all these things, and it's just kind of like a Lego block thing, you can at least set up and augment what's already there and try and, help out and rebuild the system.
Yeah, I appreciate that very much. Donald, I know you have a lot more area to cover, so
I was just going to say, unfortunately, we're running out of time, which is fine. But we can always have Laura back for another discussion on all the other subjects. But this has just been so riveting and so fascinating. The other thing, Paul, I think that I would say, having never been in such a situation, but just based on my clinical experience, which is quite obvious, you can bring all the personnel in the world that you want, but if they don't have the equipment and the facilities and so forth, it would be bringing like 100 world-class chefs to do some huge banquet, but you don't provide any cooking utensils or materials, food and ingredients. So I'm sure that, and Laura said this, there is a certain sense of frustration that your hands are tied to a great extent because you have the knowledge, you have the skill set, you have the desire, you have the courage, you made the effort to get there, and now you're limited practically by what you brought in a duffel bag or a suitcase. I can tell you, as someone who's done a lot of surgery, a lot of wound care and trauma and so forth, surgical supplies, especially wound supplies, tend to be big, bulky, large, lightweight, but big and bulky. So you could go through a suitcase full of wound care supplies in terms of dressings, bandages, and so forth in the blink of an eye after a few patients. Mm-hmm. So to think that one person brought as much as she could possibly carry with her is, as Monica said before, really like a drop of water in the Pacific Ocean.
Yeah, you guys got it exactly. And that's exactly how I felt. I felt bad while I was there. I was like, here, I've gotten all the way here. I was able to get all my stuff through the Egyptian crossing and, hang on to it. And I made it to the hospital, and I'm here and I'm ready to work. And you're just like at a wall. You just can't, there's only so much you can do. Then I lost my translator, and you feel bad. You're like, oh, I wish I could do more. I wish I could do better. All these people need repeat imaging. All of them need surgical revisions. All of them need treatment for osteomyelitis. And like none of them got it because there was no way to do it. There was no way to do any of that. And so, yeah, I mean, then you have this really kind of stinking feeling in your stomach, like, I know how to give people the best care and I'm not able to do it. And I know these people deserve the best just like any other person, and I can't do it for them.
Did you require any vaccination, immunization before going into that zone based on local disease patterns, et cetera?
Yeah, so I'm already fully vaccinated for my other exploratory activities that I participate in. So I already had typhoid, hepatitis A, all of them, yellow fever, like whatever you can get. Typhoid. You don't need malaria there. I didn't take, which is good because that makes me pretty sick too. But so they do recommend typhoid, hepatitis A. You need to be, get your tetanus, make sure your MMR is up to date, and like all of those. Everybody would need to have that done for sure.
Amazing.
And I still got sick. So that just shows you what the sanitation was like.
There is no limit, and especially for all these viruses, how can you... there is no possibility to prevent everything in this.
There's no soap. There's no hand sanitizer. There's no gloves a lot of the time. Can you imagine going wound to wound patient with none of those things?
That goes back, Monica, to the early work of Dr. Semmelweis.
Absolutely.
Peter went to medical school there. The cross-contamination of the obstetric patients, which brings up a whole other subject that we didn't even touch on. What in the world is going on with obstetrics and fetal, infant care and mortality and so forth? It must be disastrous.
They're dying. We would see them in tiny not body bags because they didn't have them. They were like wrapped up in medical OR drapes. And, people would be walking around the hospital grounds with the babies, with the dead children, and they'd take them back to their families. There was a cemetery that they had made close to the hospital where they would take people. And there's a lot of preterm births, people with, febrile diarrhea, other communicable diseases going into preterm labor. They're dehydrated. They're under a lot of stress. They're getting preeclampsia. They're becoming eclamptic, and, that whole situation's happening. So that's really a big problem as well.
Yeah, I can imagine access to insulin, things like this. I have a dear friend who just had a diabetic, first episode, severe diabetes with blood sugar through the roof, taken to the hospital. We're in a situation here where, of course, they're treating him with insulin, IV fluid, and so forth. I mean, those are emergent situations that I can't imagine how they're dealing with. Was there any, before I guess we're going to come to our close, unfortunately, here, Laura, but I promise we'll have you back to discuss other subjects. Is there any infectious epidemic occurring? I mean, you did mention febrile diarrhea, et cetera, but any other outbreaks that you're aware of?
We'll have to have me back so we can talk about lipedema and the glycocalyx and all of those things.
No, for sure. Promise.
Right. But I mean, any infectious orifice that you can imagine, it was going on. We had pediatric wards full of patients with sepsis. They're getting into bad food. They're going into old homes that have been bombed and looking for food and getting old bread that's now contaminated and poisoned and, getting sick from that. There's the GI illnesses. There was what we thought was COVID going around, or some sort of advanced respiratory virus. A lot that's, there was this baby 4-month-old who passed away, unfortunately, from just bronchiectasis. So, getting these upper respiratory, lower respiratory infections, very, very common. The wound infections, almost every single wound was infected, and there's no pain control. So if you have some partially stapled wound with a big opening, and it's full of pus, and they will squeeze it really hard and get all that gunk out of there, but it hurts so bad. I mean, it would hurt if it wasn't infected. And so, everything was infected. Everything was was a mess and dirty and contaminated. The staple remover was used patient to patient to patient. We didn't have wipes to wipe it down. Like there weren't Sani wipes even to wipe it. You know, you're not opening a fresh staple remover. You had to find the one staple remover and like use it for everybody. It was terrible.
Awful. Well, let's pray for peace. And as Monica said, let's pray for an end to this conflict so that everyone can get the care that they require on both sides, and hope that this doesn't last much longer. It's awful to hear these stories. And again, from the bottom of my heart, Laura, thank you for your service as a humanitarian, as a human being, as a healthcare professional, as a nurse, as a wound care specialist, as an American, as everything that I can think of. I have the utmost respect, really. It's unbelievable.
Well, thank you so much. Thank you for having me. I really appreciate it. And I appreciate this platform just to share what I saw, because, you know, I could only do so much while I was there. And the next step is all of us, you know, saying enough is enough, and let's take care of each other better and ceasefire. Mm-hmm.
Yeah.
That's for sure. Well, unless anybody has any other questions or final comments, I think, Paul, you can take us out, and we're definitely going to reschedule Laura for a repeat show coming up very soon, so we could talk about all the other wonderful, marvelous, uplifting, positive work that she does, because she has a lot more to share with us. But this was quite an extraordinary discussion, and I thank her for it.
No, I fully agree. Well, we want to thank you for listening and or watching and listening at the same time to our show, LymphCast. This has been episode 56. Remember to visit our website early and often, at least once a week, lymphcastnetwork.com. Email your questions to us at hello@lymphcastnetwork.com. Every episode is on YouTube. Every episode is on every podcast platform that you can find out there. Let's go around the table and thank everybody. Dr. Chubak, will you please take a moment and thank our special guest tonight?
Well, Laura, if I haven't thanked you again, I want to take the opportunity to thank you even more, because of all of the guests that we've ever had, I've never been more impressed with a human being and a commitment to healthcare. And again, we talk quite a bit on this program about the basics and the fundamentals of healthcare. We sometimes talk about some really high-end things and high-end technology and high-end surgeon and world-class experts of this technique or that technique, and high-tech science like the glycocalyx that you mentioned and so on. And we have a lot of laughs and we learn a lot, but we do it generally in an uplifting and optimistic way. Today was a little bit harder to be as optimistic, but people like you bring great optimism to the rest of us. Real heroes, people who put their as they say, money where their mouth is. But in your case, it's not money. It's you put your life on the line. You put your life on the line to take care of people that you don't know, who are strangers to you, who I presume don't have all that much in common to you personally, other than being a human being, a Homo sapien. And I think it's a great lesson to not only those of us in healthcare, reminding us why we're here, why we got involved in it in the first place, what the basis of it is, taking care of one another, helping your fellow man and woman and other, and all of that. And for those of us not in healthcare, a reminder of the fact that there is compassion in this world, there is love in this world. There are people who are willing to stake everything for what they believe in and for doing the right thing. And I get emotional actually thinking about it and talking about it, but I thank you once again. You're a great inspiration. You're a personal hero of mine. I mean that very sincerely. And the whole group that went with you and the others who followed you, I'll admit I'm probably never going to be the individual with the courage to do that personally. And for that reason, my respect is as high as it could ever go for any other human being. So thank you, thank you, thank you.
Wow, thank you very much.
All right. Thank you for being with us, Dr. Swoboda. Also from Arizona, Dr. Monica Glavitsky. Thank you, Dr. Glavitsky, for everything tonight.
Well, it was the privilege to be with you today. And Laura, I can tell you that until we have human beings like you, there is a hope. And that's what I feel. And I thank you on behalf of all these people that you could have, that you could help in, certainly not in the perfect way because there was no possibility to do so, but you did what you could. And this is beautiful. Thank you.
And I'll add one last thing to that, because you mentioned it yourself, Laura, and Monica reminded me. Just your presence there was uplifting for so many of those people to know that an outsider cared enough to travel halfway around the world, to be there, to do whatever she could or he could, the group that you were with. That must have been in itself medication and an uplifting feeling for those people who are suffering, to know that someone outside of this local area is thinking about me, cares about me, loves me, and wants to see that I get better. So that in itself, just your presence, was great healthcare and great medicine and great therapy, I believe.
Yeah, absolutely. When we had, nothing else to give, essentially we were out of supplies, we were weak and without food and water ourselves, that's what we fell back on as reassurance, was just that people would thank us, just for being there, and that as us being there was a psychological support. They felt safer with us there. And we would show them videos from back home of people, supporting them and saying that they care for them and, that type of a thing. And they really liked that. So absolutely.
Yeah, very well said. We also want to thank the gentleman who started this show. He's the founder of this show. He's also the owner and founder of Vita Support MD. They make and provide Vein Formula 1000 and lymphatic formula. And Dr. John A. Chubak, physician surgeon from New Jersey. Thank you for everything, sir. Another terrific show, another terrific job.
It was a privilege, Paul. Thank you so much.
And with that, we will bid you farewell. It's been LymphCast episode 56. We'll see you next time for LymphCast episode 57. Have a great night.